10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Hi, and welcome to this episode of Mastering Medicare. My name is Alex Sampson.
And I'm Matt Law.
And in this short episode, we're actually going to go through the biggest mistakes made during the annual enrollment period. So, as many people know, right now is coming up in less than a week here to the end of the annual enrollment period on December 7th.
Yeah, and the thing is that if you don't know, you probably haven't had your TV on, because there are a lot of Medicare ads this year. And you know, there's a lot going on. There's some new plans. We're going to talk about some of these new plans and how they may trick you today. So definitely let us know if you have any questions or if you want to review your options. Give us a call before Tuesday, December 7th, because now is the time.
Absolutely. And we have offices here in Reno and in Carson City. We're with Health Benefits Associates, as everybody knows. And so we want to make sure to meet with you before the end of that enrollment period if you haven't made your decision yet this year, just to make sure that you're in the right plan and you have everything going correctly for next year for 2020. And so right now I'm going to go over some of the biggest mistakes that people make during this time period, and also what you need to know, what the important things are to know here in Nevada for next year for 2022. So number 5, I think, counting down to number 1 here. Thinking that this doesn't apply to you because you have a Medicare supplement plan.
Yeah.
Now, I think that a lot of people that are on Medicare supplements end up turning off the TV, they end up ignoring all the mail, they end up saying, you know what, this really doesn't apply to me. And while they're partially right, I think that now is the time to pay attention for, at the very least, number 1, your drug plan. If you're on a Medicare supplement plan, there's a chances are you have a separate Part D prescription drug plan. Now, from year to year, that drug plan will slightly change the drugs they cover, and it'll slightly change the price. They should have informed you about that through the mail a couple weeks ago. And so it will not cover the exact same prescriptions from year to year, so it's important that you jump on to Medicare.gov and just look up that drug plan. You can see what prescriptions they cover and just make sure that yours is still affordable.
Well, there's another aspect, too, that a lot of people don't factor in is where you get your prescriptions. You need to make sure your pharmacy's covered. Because if you like a certain pharmacy and you have a drug plan and you renew onto it thinking you can still walk into the same pharmacy down the street, you might be in for a rude awakening. So it's always good to double check where you're going with your Medicare policies, what you're doing and how it's covered, and what the price is.
Absolutely, yeah. If you're on a Medicare supplement plan too, it can't be more important to look and compare that Medicare supplement plan to different Medicare Advantage plans that are out there. This year, we have more Medicare Advantage companies offering plans in Nevada than we've ever had.
Yeah.
And so it can't be more important to check to make sure that you're still getting the bang for your buck on that Medicare supplement plan that you have. Because sometimes that supplement increases in price. It does it to all supplement plans. The deductibles for Part B go up, and they're going up next year.
Yeah, they're going up quite a bit. I think the Part B deductible is $233 next year, is that right?
Yeah.
Yeah,
right.
So the thing is that with Medicare costs increasing and unfortunately your Social Security checks not increasing at the same rate, it's always a good idea to research your options because everyone's budget is changing as they get older, and we want to make sure that all of you, including myself when I get to retirement, can actually enjoy our lives without worrying about paying premiums every month and breaking the bank.
Great. And many of these plans, I mean, we used to have a lot of clients who would exclusively go with Medicare supplements. These Medicare Advantage plans have changed dramatically over the last couple of years, and there's really is no one-size-fits-all on these things. I want to be very clear that we don't encourage people to go in one or the other. Our job is to present the options clearly and to let our clients make that decision for themselves.
Absolutely. And I will say that just based on statistics nationwide, Medicare Advantage plan enrollments have doubled over the past decade. So just from the perspective of not just here in Nevada, but nationwide, Medicare Advantage is becoming more popular, and a lot of our clients who have been on Medicare supplement plans for a decade or more might be the right time to start shopping, because these plans are a lot different than what they used to be.
Right. And so, to be clear, this Medicare annual enrollment period does apply to Medicare Advantage plans. And so, just to draw the line in the sand, Medicare supplement plans don't have an annual enrollment period where you can switch those supplement plans anytime you want. There is some new legislation coming out that might change that. And so if you do have a supplement plan, you want to shop for other supplement plans, give us a call. We definitely want to talk to you about that and see if you're eligible to qualify for those plans in the upcoming year. So we want to make sure that that's for you.
The other thing I will say, I'm just going to toss this in there, is that a lot of people keep their Medicare supplement plans for the nationwide network, which, as someone who's from California, and a lot of people here in Northern Nevada are from California nowadays, we like to have access when going back to the Bay Area or SoCal or wherever. Now, the thing is that Medicare Advantage plans, some of them will include nationwide networks for routine care. So if that's an element that you hang on to your Medicare supplement policy for, you may want to give us a call just to talk about what other options are out there so you can still get the same coverage but save money at the same time.
Absolutely, yeah. So number 4 here, not checking the doctors or prescriptions before switching plans. And so we can't stress this enough. I don't think people understand that each different plan covers different doctors and prescriptions. And so a lot of people are just switching plans because that's the one they saw on TV, that's the one they received in the mail, that's the one the friend talked about, and they said it was great, so they went to it. And then they didn't realize that their doctor, their specialists, their labs, the medical facilities where they go to, the hospitals they go to, all of these facilities will depend on the specific Medicare Advantage plan you select and the company you select it with. And so it can't be more important to work with somebody, first of all, work with somebody who represents all of the different Medicare Advantage plans that's out there. That way you have an unbiased, unfiltered opinion that somebody can present to you and say, listen, this covers the doctors you need, this doesn't. And so that couldn't be more important during this time to evaluate the doctors, the prescriptions, and what basic benefits you need in your plan to determine which one's right for you for next year.
And to make it even more confusing, if you sign up for a plan that covers your doctors, it may not cover your doctors in the future. These contracts change all the time. Yeah. This is not just Medicare Advantage. This is Medicare Supplement as well. So this is where people think that, I have this plan, I'm good, everything's covered today, and I can just keep it for the rest of my life. Not necessarily the case.
Right, absolutely. So we made a short video we'd like to show you now, and so we'll meet you on the other side of this.
You're now entering another dimension. A dimension of choices. Choices that need navigating. Choices that will lead you to the Medicare zone.
Sue just retired and became eligible for Medicare. She has now decided to travel to different parts of the country so that she will be able to see her grandchildren. She is now making a decision between a Medicare supplement plan and a Medicare Advantage plan. She wants to make sure that her new plan will cover doctors outside of Nevada. What options does Sue have to get nationwide coverage? 1. Medicare supplement plans are the only plans that cover doctors outside of Nevada. 2. All Medicare Advantage plans cover doctors outside of Nevada only in an emergency. 3. Some Medicare Advantage plans have a nationwide list of physicians. 4. Medicare supplement plans cover more doctors than original Medicare Parts A and B.
Great. So we're going to go over those questions, obviously, right now. I'm going to actually ask them here to Matt, and then he's going to give me some of the answers and going to test his knowledge.
Oh, great. All right. Okay.
So answer A, Medicare supplement plans are the only plans that cover doctors outside of Nevada.
It's false. There's a handful of Medicare plans that I can think of, Medicare Advantage plans that cover out-of-state doctors for routine services. So definitely false.
So B, all Medicare Advantage plans only cover doctors outside of Nevada in an emergency.
Also false. Now this is an interesting one, because this used to be the way Medicare Advantage was maybe 5 to 10 years ago, but nowadays there are a slew of plans that'll cover you out of state in non-emergencies, like a planned surgery or a planned doctor's visit.
Yeah, absolutely. C, some Medicare Advantage plans have a nationwide list of doctors.
True. That is true. Some do, not all of them.
Yeah, perfect. And D, Medicare supplement plans cover more doctors than original Medicare Parts A and B.
Tricky one. The answer is no, false. A lot of people think that getting a private Medicare supplement plan gives you more doctors, or the doctors are paid at a higher rate than the government. Believe it or not, you're actually getting the same access to doctors on a private Medicare supplement plan as you would on just original Medicare Part A and B.
Perfect, yeah. And a lot of people think that if they elect a different supplement from a different insurance company, so if you elect one insurance company over another, that reimbursement rate is going to be different, or that some doctors will take this supplement and not that supplement. With a supplement plan, it's going to be accepted by any doctor that takes original Medicare. Now that can't be more important, because this is not the same doctor's list that might take Medicare Advantage plans. And so these will be two different things. But we can't state it enough. Medicare supplement plans, if your doctor takes original Medicare, they accept the supplement. That's the way it goes.
Now, also make sure that they're accepting new patients as well, because based on statistics nowadays, 21% of doctors in the nation that accept federal Medicare, original Medicare, 21% of those doctors do not accept new patients on Medicare supplement plans. So a lot of stuff that goes into making sure that your doctor is actually going to see you and be accepted on your Medicare plan, regardless of what type of policy you have.
Yeah, perfect. Well, back to the biggest mistakes made during the annual enrollment period. Number 3, thinking if I don't do anything, everything stays the same. So I can't state this enough. No matter which plan you're on, supplement, advantage, drug plan, whether you're on just original Medicare Parts A and B, nothing stays the same from year to year. And so when, at the very least, you're going to see a slight increase in the Part B deductibles. If you're on a supplement plan, specifically Plan G, where you pay that Part B deductible, that's going up next year. Last year is $203?
$203, and now it's going up to $233.
Perfect, yeah. And so that couldn't be more important. Also, the additional benefits that you'll see from each insurance company are going to be different. The co-payments that you'll see through Medicare Advantage plans usually change from year to year. And so there are slight changes on the plan always. And so also the drugs change from year to year. And so can't stress it enough. I mean, we've already stressed it enough in this video. Doing that annual evaluation just to make sure you're on the right plan can't be more important.
And something I always say, I think maybe I'll get a tattoo at some point that says it, is the only thing consistent is change in healthcare. So just keep in mind that what was great in the past may not be great in the future.
Yeah.
So.
And doctors end up working with different insurance companies as well. And so doctors might have accepted your plan last year. Your favorite doctor might not be accepting your plan next year. So number 2, for those on a supplement plan, staying on the same Part D and thinking the cost will stay the same. And so in general, the Medicare drugs will still be covered on the same plan from year to year. Most of them will. But as always, we get the calls in January, February, March for the clients that we have where their drug was dropped and not covered anymore, or maybe the formulary now includes a generic that they cannot take, or they tried and did not work. You know, there are all sorts of other outstanding circumstances that happen where a drug might not be covered from one year to the next on either a Medicare Advantage or a Medicare Part D prescription drug plan. And so it is important to just check, just to make sure those drugs are covered from year to year and that nothing changed as far as that goes. Finally, brings us to number 1 here, not considering the other factors. So we get calls during probably the first 3 months of the year from people who bought plans online. They bought plans directly from the insurance company. They bought plans over the phone, from somebody who called them in the mail, I don't know, wherever. And whoever it was that placed them with that certain plan did not give that person the full heads up about which doctors were covered, what prescriptions are covered. That's the meat of the plan. So on a Medicare Advantage plan, there's a lot of information going on right now about that Part B reimbursement.
Oh, yeah.
Yeah.
Yeah, it's very misleading because I get clients calling me all the time asking if there's a way they can get 100% of their Part B premium paid for. And I'm sure in some state elsewhere there is a plan that does that, or someone who has Medicaid can get that paid for. But realistically, here in Nevada, we do have a handful of plans that will give you a minimal reimbursement for Part B, but usually leave out a bunch of big benefits like prescriptions.
Yeah. And so those plans can be right for some people. And I have a handful of clients that are in a plan like that. They're mostly veterans. And all sorts of other people that have other drug coverage through another source that's qualified, or in rare circumstances, there are all sorts of other situations that might be good for that type of plan. However, I want to make sure that it's very clear that a lot of people buy those plans because of all these extra benefits, and then they leave out the meat. They don't understand by the time that comes around that it didn't cover their primary care doctor, it didn't cover the prescriptions they need, and now they need to go to some obscure place where they don't really receive care, where they don't know anybody, to go get medical services. And so it really is a bait and switch technique, and we really don't like to do that because here we have our office open all year round. We're not just closing our door and changing our phone number like many other agencies do at the end of the annual enrollment period. And so it's more important to us than ever. We've been in Reno for over 35 years doing business here. More important than us to ever, more important to us that we maintained that relationship with you and have a good ongoing relationship as we move forward with Medicare. To do that, we need to put you in the right plan that you're going to love and that you're going to be happy to tell your neighbor about. So that's where we are.
Well, the other thing too is that, if you sign up for the wrong plan, you may think, well, not a big deal. I'll just switch it next year. No harm, no foul. If you sign up for the wrong plan that doesn't, let's say, include drug coverage, did you know you'll get a lifetime penalty? And that's for the rest of your life, so that's a lifetime penalty. So there are a lot of things that if you, just like we're talking about in this video, that if you slip up on and you forget to check those boxes while finding the right plan, it may hurt you and haunt you for the rest of your life.
Right. And so we want to make sure there is and I'll touch on this briefly because I do not want to advertise this at all. If you did make the wrong decision and you're watching this video in January, February, or March during the first 3 months of the year, you can make a one-time switch if you're on a Medicare Advantage plan, either to original Medicare or to a different Medicare Advantage plan. And so that is not something we want to encourage you to do. We don't have a lot of our clients that do that at all because we did the homework ahead of time to say, yes, they know exactly what they're getting. They know the drug. It covers these drugs. They know it covers these doctors. And so we do not have a lot of clients that end up taking advantage of that switch. But if you're watching this and you realize that, you know what, I think I made a mistake, this isn't going to work for me, no problem. We can always come contact us. And so I would say come contact us and we can still do something. We can usually help you. Or if we can't, then we can tell you when the next available time is when we can.
Absolutely. And
Yeah.
the thing is that throughout the year, there's always special enrollment periods that occur to people, different situations, people moving here from California or other states. And there's a lot of different reasons for you to switch plans and a lot of options that allow you to switch plans if you're in a specific circumstance. So just know that if something's not working, we're always here to help and help you find the right plan when the time's right.
Right. And so we're going to take a couple of Q&A questions. Let's see if any came up here.
Yeah, so we actually got a handful of questions. I got one from Still Scotsman. So hello, I'm assuming your name is Scott. And you're asking, what happens if you don't enroll by December 7th? Does your current drug plan just continue as is? You want me to take this one?
Please.
Okay. So the thing is that depending on the plan you have, it may automatically renew. And every drug plan insurance company, every insurance company in Medicare for that matter of fact, will send you an annual notice of change right around October 1st. That annual notice of change will compare your current benefits to the renewing benefits, and it'll actually tell you in clear verbiage whether or not you need to do anything to continue your plan into the next year. So some plans will continue, or actually most plans will just continue during the renewal period. You don't need to do anything by December 7th. It'll just carry forward. But sometimes these plans will get phased out, and if you're not reading your mail, you may end up without a drug plan for the new year.
Yeah, absolutely. And so the Medicare Part D prescription drug plan company that you're with will definitely know that. I'm sure that they are receiving a lot of calls. And so if you lost the mail, if you're on hold for 2 hours and don't know, you can always jump on to Medicare.gov, put your drugs in, and just shop plans, just start fresh and purchase a plan right there. And that can be a great way to go. Don't think that, a lot of people think that because they're with a certain Medicare supplement plan, that they need that same company to do their Part D prescription drug plan. That is not the case. These are two completely different companies. Even if you bought them both from the same company, they're completely different departments. They don't talk to each other. You think they coordinate and work together. They do not. And so don't hesitate to switch that Part D prescription drug plan whenever. And a lot of people are not paying, a lot of people think that the standard is to pay $100 plus per month for a Part D plan. I mean, there are many out there that are very affordable that are much less than that.
And for 2022, the average costing drug plan in the nation is right around $31. So just keep that in mind that if your drug plan premium is around, here in Nevada, $7 to $35, you're right in the right ballpark for a plan for most people.
Yeah.
So we have a few more questions. Ron Casanelli has a question. He says, is Prominence an Advantage plan or a supplemental plan?
Yeah, so Prominence is a Medicare Advantage plan. They are one of our great carriers that are here in Northern Nevada. So they're owned by Universal Health Services, and they own Northern Nevada Medical Center, the new Northern Nevada Sierra Medical Center that's off of Longley and Double R right there. They're going to be completing that hospital in March. And so that is one of the newest hospitals, the newest hospital actually here in Reno. And then they also have a lot of contracts with independent doctors that are not affiliated with any hospital or medical group at all. And so that can be a great way to go for a lot of people that are comfortable with those facilities.
Yeah, and it is a great option here in Northern Nevada. And I think Prominence is making a splash nationwide as well. They sell insurance in more than just Nevada. They sell in Texas and Florida.
That's right. Yeah.
Their headquarters is here in Northern Nevada, so Prominence may be a big player nationwide in upcoming years.
Yeah.
Okay, it looks like we have one more question, and it's from Still Scotsman again. If you pay for a Medicare Advantage plan, why do you still have to pay for Part B? Don't the Advantage plans already include doctor services?
So if you're currently paying for a Medicare Advantage plan, and many plans out there, people don't understand, do you have that monthly premium that you pay for a Medicare Advantage plan? If you pay that monthly premium, now that goes to the Medicare Advantage private company that you're with. Also, that doesn't cover the full cost of medical services. And so you're still seeing that Medicare, federal Medicare, is still reimbursing Prominence. I'm getting a little bit too far into the billing here, but federal Medicare still reimburses Prominence for you to be on their plan, if that's specifically who you're talking about, or other insurance companies, any Medicare Advantage company that's out there. Prominence doesn't have premium.
Well, and the thing is, too, is that when you are enrolled in both Part A and Part B of Medicare, and you're paying for Part B out of your Social Security check or getting a bill in the mail, that's something that you're paying regardless of the Medicare Advantage plan you're enrolled in, regardless of the Medicare Supplement plan you're enrolled in. So that is almost like a tax.
Yeah.
You're enrolled in Medicare, and you think you've paid your fair share into the Medicare system by working all of these years and paying taxes. I hate to say it, but when you go into Medicare, you're still paying into the system via Part B. So it is nice to have a Medicare Advantage plan with no monthly premium on top of the Part B costs that you're paying, but just keep in mind those Part B costs do not go away unless you have assistance through the state like Medicaid.
Right. And also, those co-payments will differ from plan to plan, though. So if you look at those co-payments, let's say a separate little $20 or $40 for a specialist, or the co-payments for inpatient hospitalization, those will change based on the different Medicare Advantage plans that are out there. And so that's why it is important to evaluate and compare which one might work best.
Yeah. Well, and actually, I'm gonna end the Q&A with a question myself. Speaking of what is best, Alex, let's say hypothetically I'm going in for a surgery, so a major surgery, and I want the best Medicare plan. What are you going to recommend, Medicare Advantage or Medicare Supplement?
Well, that's a good one. So I think that I'd say there's no really one size fits all. And so for a lot of people, I have a lot of people that went in for major surgeries and they were on a Medicare Advantage plan and they absolutely sung its praises. I mean, the low monthly cost, a lot of people are saying, well, I'm going to save that monthly cost and then I'll have enough money for all those co-pays instead of paying it out to the Medicare supplement company. That can be a great way to go. They have really low cost to go in and use inpatient hospitalization and surgeries, outpatient surgeries, and prescription drugs after that. So that can be great. I mean, those people love those plans. On the other side of the fence, I have people that love their Medicare supplement because they want that flexibility to be able to walk into the Mayo Clinic or walk into any facility that takes original Medicare and go get services. And so I don't think that's a tough one. I really don't think there is one size fits all. I think it's kind of a toss up. What do you think?
I actually 100% agree. I mean, when I talk to my clients, whether it be, for example, I went through sleep apnea surgery about 3 or 4 years ago. Pretty major hospitalization, planned surgery. I could go either way, but I would say it really is going to come down to the network list, what my budget is, maybe physical therapy after. If I have physical therapy, I may want to choose a plan that covers that really nicely. So even a surgery where you would think it's a high costing service, it must be the same recommendation every time. It's not. It really isn't.
Yeah, right. And really, we don't encourage one over the other. So our job is to more present everything equally. And I'll have a client 1 hour that'll come in and say, I would never switch my Medicare supplement and offer $1 million. And I have another client that'll say the exact thing about Medicare Advantage the very next hour. So really, I think that it really is, there's so many options now and it's so customizable that there is no one size fits all in these things.
And that's why
it is unique.
And that's why we're making this video and talking to you right now and hopefully reaching and connecting with you is that, we don't want you to make the mistakes that other people that we've come across have done during the annual enrollment period, whether it be just sitting back and keeping what they have or signing up in a plan that they saw on TV. I mean, there's a whole bunch of mistakes you can make, and our whole team here in Reno and in Carson City, we're happy to help you navigate the system and make sure you're not making those mistakes.
Absolutely, yeah. So thank you for joining us on this episode of Mastering Medicare. This is our last episode of the year, but we want to join you early next year. So I'm Alex Sampson.
I'm Matt Law.
And we're signing off from Health Benefits. Thank you.